Hello, my name is Samantha Holden. I'm a cognitive and movement disorders neurologist at the CU Alzheimer's and Cognition Center. I'd like to talk to you a bit about Lewy body dementia today. Lewy body dementia is the second most common cause of neurodegenerative dementia after Alzheimer's, accounting for 10 to 25% of cases. Lewy body dementia is an umbrella term, including both Parkinson's disease dementia and dementia with Lewy bodies. These two conditions are likely on a spectrum rather than two completely separate conditions, and there is a lot of overlap in how they present as well as how they're treated. The only difference between Parkinson's disease dementia and dementia with Lewy bodies is what symptoms come first and are more prominent and bothersome to the person. Parkinson's disease dementia is the development of dementia in the setting of well-established and diagnosed Parkinson's disease. Parkinson's disease is characterized by bradykinesia, slowness of movement, a resting tremor, and rigidity of the muscles. About 80% of people living with Parkinson's will eventually get dementia in their lifetime, though it is usually a later symptom that develops in the course. People with Parkinson's starting later in life, in their 70s, 80s, or even their 90s, are at a much higher risk of getting dementia in their lifetime compared to people with younger onset Parkinson's disease in their 50s or 60s. Dementia with Lewy bodies is where the first symptom and more prominent symptoms are cognitive, thinking and memory changes. And that's what brings the person to medical attention. The thinking and memory changes in both dementia with Lewy bodies, as well as with Parkinson's disease dementia, are somewhat different than what we see in Alzheimer's disease. While there can be some forgetfulness and memory loss, there is more prominent executive dysfunction, difficulty with planning, multitasking, making decisions, as well as visuospatial dysfunction, spatial relationships, navigation, how things fit together. Dementia with Lewy bodies must have a degree of cognitive impairment that the person is no longer independent in their day-to-day life because of it. Obviously, people start with more mild cognitive impairment, but we don't yet have diagnostic criteria to diagnose mild cognitive impairment due to Lewy bodies, but there is ongoing research in this area. In addition to the cognitive changes, to diagnose dementia with Lewy bodies, there must be 2 of 4 core clinical features. These include Parkinsonism, the slowness, stiffness, and shakiness that is also seen in Parkinson's disease. Usually, the tremor is not as prominent in dementia with Lewy bodies as it is in Parkinson's, and it can be less with rest and more with action or posture. More prominent is that bradykinesia, the slowness of the movements. Other core clinical features of dementia with Lewy bodies include visual hallucinations, well-formed people or animals that nobody else is seeing. Often early on, there is insight into the hallucinations not being real, but as the condition progresses, that insight can be lost. REM sleep behavior disorder, or the acting out of dreams in REM sleep. Our bodies should be fully paralyzed while we're dreaming in REM sleep. In people with both Lewy body as well as Parkinson's disease and another related Parkinson's-like condition called multiple system atrophy, people can act out their dreams, and this can start years before any of the other neurological signs or symptoms. We often ask about dream enactment, especially to bed partners, or if they're restless sleepers, or if they've fallen out of bed mistakenly. But the only way to be 100% sure if somebody has REM sleep behavior disorder is to do a full sleep study. The last core clinical feature of dementia with Lewy bodies are cognitive fluctuations. These can be very difficult to pick up objectively, Everybody fluctuates and has ups and downs, good days and bad days. But people with Lewy body can have good minutes and bad minutes, very dramatic and significant ups and downs in their level of alertness, awareness, or attention. Oftentimes, these fluctuations can even be confused for seizures and episodes of zoning out, or concerns about their heart with drops in blood pressure or their heart rate that are causing them to black out a little bit. If somebody has 2 of those 4 clinical features, in addition to the cognitive decline that's affecting their daily function, Parkinsonism, visual hallucinations, REM sleep behavior disorder, and cognitive fluctuations, 2 of those 4, and we can say this is probable dementia with Lewy bodies. The treatment of both Parkinson's disease dementia and dementia with Lewy bodies is fully based on the person, what bothers them, what's impairing their full enjoyment of their life, what's a safety concern. But we will treat thinking and memory, their movement, their sleep, their mood, all based on bidirectional discussions between their physician, their care team, as well as them and their loved ones. We hope to learn more about the Lewy body dementias, both Parkinson's dementia and dementia with Lewy bodies, how it's different from Alzheimer's and the other forms of dementia, come up with better treatments, better ways to diagnose it, as well as eventually curing and stopping these conditions.